Hi, it's Ashley again with Complete Health Benefit Solutions. And now I want to take some time to talk about what to do for coverage when the retiree goes on to Medicare and there's a spouse left still needing insurance, but not yet eligible for Medicare. I've talked to so many retirees who are in this exact situation and spending so much money on insurance premiums and really wanting to know if it's the right thing to do. Are there really any other options? It's one completely different ball game when the retiree is not yet eligible for Medicare. But once the retiree becomes eligible for Medicare, whether that's 25 months after they were awarded disability, or if it's when they turn 65 and they do go on Medicare, one of two things happens. Either premiums skyrocket to keep the same benefits because you have to go on to Cobra, or you have to choose another plan. And there just seems to be a lot of retirees who have wanted to talk through that in detail. So I wanted to make this video and go over it with you. So I'm going to be bouncing back and forth between some slides because it's a bunch of information, and instead of having to watch me the whole time, I did put some of it down for you so you have a visual to look at. If you want any of this information after you've watched this, feel free to reach out to me and I'm happy to provide it to you. I just don't want you to worry about taking notes the entire time. So I want to talk about what the different individual coverage options even are for somebody under age 65 when you're not getting your insurance based on active employment. The spouse is left with paying for Cobra, which is the plan GA 4600, or you do have the option of changing to A, B, or C, which is on the GA 2300 111 plan. Another option that is available in the situation of losing coverage is the Marketplace, which is the Affordable Care Act. And then the third option that a lot of people are not really aware of is various plan options that are available that are considered non-compliant with the Affordable Care Act. And what that is referring to is plans that don't meet all of the consumer protection provisions of the Affordable Care Act. So starting in this year, so starting in 2019, just this year, the individual tax penalty, so that penalty that people would get on their income tax for either not having insurance or not having ACA compliant insurance, went away. And so that really changed some things in the market, and we'll talk about that in detail. The types of plans that are sometimes a good fit for people are short-term medical, indemnity medical plans, and in some cases, health sharing ministries, the Christian plans you may or may not have heard of. Also, we will talk about how the different federal or state rules can really impact the plan availability to you, as well as just the insurance company presence. So there's several different factors kind of there that we will talk through. This is definitely not a conversation that I can be extremely detailed as far as showing you different plan designs and exactly what it's going to cost, because that does vary state to state, and we'll talk a little bit more about that. Also want to talk about how you can kind of strategically package plans together to really optimize your protection and kind of fill the gaps. So for some people, the $1,200 a month price tag that comes along with Cobra is either not affordable or just not something that they want to spend that much money on. So when we're looking at some of the other options and whether or not they would be a fit that would be worth considering, it's important to know how you can fit different plans together to give you the best coverage. And last, I'm going to go over some actual examples with you of kind of workups that I've done for the spouses of other retirees that really break down the numbers of what the cost savings might be and how significant they can be, because I think that a lot of people are pleasantly surprised at the very comprehensive coverage that you can get at less than half the price of what this Cobra plan is paying, and really minimize your out of pocket costs. So there's really an opportunity to be able to, make sure that you're utilizing your healthcare dollars in the best way possible. So let's take a look at the different plans. And really, there is those same categories that we had already talked about. So your Cobra or retiree option is going to be benefits and a provider network that you're familiar with, which is definitely a positive. But for somebody who's healthy, who is not a high utilizer of the healthcare system, that is an extremely high cost when you're looking at the course of a year, to be paying over $12,000 just in premiums. And then you still have a deductible and still have a co-insurance amount. I'm sure you're aware you've got that very low deductible of only $100, but then you have a co-insurance responsibility that doesn't really have an end to it unless you have Plan E supplementing the early retirement plan. Then you have an out-of-pocket max of $5,000, but you could still pay $5,000 out of pocket on top of spending over $12,000 in premiums. Also on that Cobra plan, the benefits are limited to $500,000 in a lifetime. So there's several situations where you may, if you're getting close to that, that could be an issue. In that case, your next best bet is going to be the marketplace, but we'll kind of work down the line there. The plan does have limited preventive services. So that was kind of a surprise to me, but it is not going to cover, as I'm sure you probably know, your annual physical preventive exam that most people are used to being covered in some situations. Maybe you're not. But it does cover 100% for things like mammograms, pap smears, colonoscopies, PSA tests, stuff like that. It seems to me like the Cobra plan would be the best fit when you're factoring in the cost that you're paying and stuff like that. Really, for somebody who is currently or has recently experienced a medical event or medical condition that they're in the middle of treatment for. But you want to make sure that if you're going to spend $12,000 plus a year on premiums, that you're getting some value for that, utilizing that plan. One of the other options available, like I mentioned, is the marketplace, aka Obamacare plans, which were derived from the Affordable Care Act. This really is, out of all the different plan types that we are going to touch on, it's really the only one that offers the full consumer protections that came along with the Affordable Care Act. So that's going to be things like no pre-existing conditions, no underwriting. You can enroll in a plan and you have to be accepted if it's within one of the enrollment periods. And they have to take you, and they can't charge you more if you're sick. but you also don't get charged less if you're healthy. So that has kind of resulted in those plans being very expensive. Sometimes unaffordable if you do not qualify for a premium tax credit, which subsidizes the premiums. And that's going to be based off your household income. But that may be something to consider. If you and your spouse are both retired, and very commonly, maybe one spouse did not work or is not yet claiming Social Security or railroad retirement benefits, and you're really living off, say, the RRB monthly income, which potentially less than 5,000 a month. That's just a number I'm throwing out there. Depending on your household size, you could qualify for a subsidized premium. So that's a possibility, something worth looking at. But for many people who don't and are healthy and a low utilizer of healthcare, then again, that's going to be a really expensive option. Really varies state to state and by what plans are available in your state. Like I mentioned, the marketplace plans do have very specific limited time frames that you can enroll in those plans. So that's going to be the annual enrollment period, which matches up with the Medicare annual enrollment period, where you can change your drug plan or your Medicare Advantage plan, and then it goes 1 week longer. So October 15th through December 15th of every year, anybody can enroll in a marketplace plan, not go through any underwriting, will have benefits start on January 1st. Really, the only variable there is whether or not you would qualify for a premium tax credit, which would lower that monthly premium. One thing to know about these plans is in most places they are HMOs. So you're going to have a much more narrow provider choice than what you're used to. And then if you go out of the area that you live in, a lot of times you're not going to have access to care for anything other than emergency care. Also, the plans that are available to you, which means the benefits within those plans and the cost of the plans, can change year to year. That is not really something that is predictable, and we usually don't know what the plans that start in January are going to be until October 15th. So right when it's time to enroll is when you know what plan you would be starting in less than 3 months. Then there is Health Sharing Ministries, and I want to look at it from this perspective so you can kind of see. On this slide, I kind of combined the marketplace plan with the COBRA plan there on the far left, just because those benefits are going to be the most alike. And then you have the other three categories where things start getting different. So with the COBRA and marketplace plans, and then tying in the Health Sharing Ministries, that's where you're going to see the higher deductibles, higher out-of-pocket maxes, which higher costs for care, as well as higher monthly premiums. So your skin in the game is going to be a lot higher with those plans than it is with, say, the short-term medical or indemnity plans. But a lot of times, for somebody who does have medical challenges or really wants the most comprehensive coverage, that's what you're paying for. So that's something to keep in mind. So the Health Sharing Ministries, I don't know how many of you are familiar with those, but those are going to be the Christian plans. So some of the common names that I think people might be familiar with could be Medishare, or there's one called Liberty. But there are several different health sharing ministries, and they really started becoming more popular after the Affordable Care Act went into place, because there's an exemption called the religious exemption. And so what it does is let plans that have a religious basis be exempt from many of the Affordable Care Act provisions. So the health sharing ministry plans are often most look and feel like traditional medical plans along with the premium cost, but they can apply pre-existing conditions. You do have to go through an underwriting process. So because of that, the premiums still end up being pretty significantly lower than what they are when you're looking at, say, Affordable Care Act plans or like COBRA situations. So going back to our slide here, the risk, or I guess kind of disadvantage to the health sharing ministry plans, because like I said, the positive is they're going to look and feel the most like the Affordable Care Act plans or the COBRA plan that you may be enrolling in. The disadvantage is, especially right now, there are several insurance commissioners, so the guys that head the Department of Insurance for several different states, who are not happy. They know that some of these organizations used that religious exemption to skirt the Affordable Care Act mandates. And so they're kind of on a mission right now to shut them down or shut them out. No idea how successful they would be. Plus, they're not all created equally. Like with many things, like with most things, every company is not the same. So the different health sharing ministries have different rules as far as how your coverage works. They also have different reputations and recognition by providers. I have a couple of clients that have multiple kids, so full families who they are self-employed. They're both actually physicians, one in Arizona, one in North Carolina. And because they are not going to be gaining any other insurance anytime soon, their families need long-term coverage. The health sharing ministry plans really were the best fit. In both situations, we saved about $2,000 a month in premiums compared to if they would have enrolled in a similar plan through the marketplace. So short-term medical, a lot of people look at it as catastrophic coverage. So the short-term medical really is exactly what it sounds like, going to be a better solution for people who truly need it on a short-term basis. So maybe to get you through 3 months or 6 months. But then you also have to understand that during that time, it's really only going to cover you for the big what ifs, expensive hospitalizations, unexpected expensive surgeries. Anything beyond that, any more regular kind of use of the short-term medical, a lot of people would be disappointed because, like I said, it's not going to cover doctor's visits unless you've met that deductible. They usually do not have benefits for prescriptions either. They don't cover preventive care. They are just not designed to be on long term by themselves. So something that is a good tool to use strategically, not a good long-term solution, but definitely something you want to have an understanding about. So looking back at our information here, indemnity plans. How they work is there's no deductible for you to meet. So it has what they call first dollar coverage. And that means that if you have a service you don't have to meet a $100 deductible or a $5,000 deductible, and there's no coinsurance, there's no out of pocket. Each indemnity plan is going to have a set, what they call schedule of benefits, which basically lists out the exact dollar amount that it is going to pay for each service that is covered under the plan. So if you incur one of those services, the plan is immediately going to pay that dollar amount. It is not going to pay more, it is not going to pay less. And so here's where it really gets interesting. So in some situations, you can walk away from having a medical service expecting a check in the mail. That's because it's not going to pay less than what the schedule of benefits is, even if your bill is less than that. The flip side of that is if your bill is more than what the schedule of benefits is, the insurance is going to pay first dollar. You don't have to pay first, but whatever's left, you will be responsible for. So when you're thinking about things like a hospitalization, most people expect to be coming out of pocket for that. Depending on your coverage level and the benefits that you select with an indemnity plan, you may or may not have a responsibility for a hospitalization, especially if you're in there for something minor. You very well could end up with a check in the mail when it's all said and done. So we'll take a closer look at that so you can have a better understanding. But again, the indemnity plan is going to fall under the non-compliant plans. So either it usually does not have a prescription benefit, or it will have a limited prescription benefit. You do have to go through underwriting and get approved for the plan. So most people who have major chronic conditions or have had major medical events in the last 2 to 5 years would have a hard time getting approved. Plus, it's not, some of them cover preventive care, but it is not the you pay nothing out of pocket, no cost share, long scope of preventive services that are going to be covered at 100%. I would say that the biggest weakness of the indemnity plans is those last two things I touched on. So the prescription benefit, as well as the wellness or preventive benefit. I think you guys in particular are probably more accustomed than most people are to not having a really rich preventive benefit, because the Union Pacific plan was grandfathered, meaning they did not follow all of the guidelines of the Affordable Care Act, and preventive care is one of those things that they didn't make all of those benefits available. So looking at those next details that we had started to go over, and then sorry, backtracked a little on you. So the short-term medical, and again, that's going to have those same similarities with either no or limited prescription benefits. Like I mentioned, has those terms that you can only be enrolled in the plan for a specific amount of time. Usually the terms, though, are 3 to 12 months. And then what happens is when the term starts over on the plan, you start over on your deductible. And this is where short-term medical can get a little more concerning, especially if you're looking at 3-month terms and you are able to re-enroll in the plan at the end of 3 months. If you had something happen during that term and you re-enroll in the plan for the next term, whatever happened, whatever medical condition came up or anything that required treatment, that could be considered a pre-existing condition in the next term and not covered. So that's definitely something to be aware of with short-term medical. Also, short-term medical plans do have a lifetime limit. Depending on the plan that you choose, though, that limit is usually between 250,000 and 1 million. A lot of people who enroll in short-term medical plans are not used to seeing a lifetime limit. The Affordable Care Act eliminated that from most employer-based plans back in 2010, I think, somewhere between 2010 and 2013. But again, you guys on that UP plan are accustomed to that because that plan was grandfathered. The indemnity plans also have that lifetime limit, but they're usually much higher. They're usually more around $1 million. I've seen some with 2 million. Some do assess what is called a per incident limit. So I've seen those to where, say, if you have an injury, the most that the plan will pay out for that injury may be capped at $150,000 or $200,000. So all those different kind of provisions you need to look at. But one thing that I think is worth noting about the indemnity plan, it truly is, I feel like, the most flexible. You can do several things with it. So you could either pair it with another one of those benefit options that, say, maybe has a really high deductible and you want something to help cover your cost of that deductible. The indemnity plan would do that because, remember, you don't have to meet a deductible before it starts paying. You just have to look at how much you end up spending in that situation. But with the indemnity plans, there is usually multiple plans available with different levels of coverage. So a lower level of coverage, which means it's going to pay out lower dollar amounts for services, is, as you guessed, going to have a lower premium. Sometimes that's a really good fit to, say, pair with a short-term medical plan, or if you get a premium tax credit to lower the premium on the Affordable Care Act plans, even couple with one of those plans to where you have the safety net of the plan that has the deductible, coinsurance, and out of pocket that you're used to, but this indemnity plan that's going to step in and hopefully cover the majority, if not all, of the deductible amount if you require services that would meet that deductible. Plus, it does a better job of covering kind of your day-to-day type services, so doctor's visits and some preventive care. But that's on the low end. On the higher end of those plans, where you choose the plans that pay those higher benefit amounts, of course, you're going to pay a higher premium for that, but a lot of those benefits cover a wide enough range of services and pay a high enough dollar amounts that they can stand on their own, that you would have, really good coverage that for a healthy person would more than meet their needs, plus offer them really important financial protection for the what if something did happen, without paying an arm and a leg for premiums. Because it's a really tough situation to pay a huge chunk of money just to give yourself the safety net for, what if? What if there's a car accident, or, the C word that nobody wants to hear, or a heart attack? Those things not only are scary, but they can be just incredibly expensive. One thing that I do want to touch on are used to your network with your current plan. All of the other ones will have networks too. We talked about the marketplace plans usually being a little bit more of a narrow network. Most of these other plans, so the health sharing ministry, short-term medical, indemnity plan, almost all of them use the same network. It's called multi-plan. It is the biggest network just
in the
know
country.
that that does become a very important part, especially with the indemnity plans, of utilizing the network, because then you get that network discount, which can be significant. It can be up to 80-90% sometimes, off that full billed amount. So it dramatically reduces the billed charges, which is important when you have a set dollar amount that the plan is going to pay. Let's look at, I had mentioned there are different rules, and for the most part, this is state by state. These different rules that are going to impact the plans that are available to you. So, what you have to choose from if you choose to look outside of COBRA, and how much those plans are going to cost. So, there are baseline federal rules around these plans. So, a good example of that is the federal baseline rule around short-term medical is that somebody should not be enrolled in a short-term medical plan for more than 3 months. They were really only allowed for people to transition maybe in between jobs or something like that. But then states can impose their own rules that in that state kind of trump the federal rules. Now, they can't disregard the federal rules, but they can apply their own rules, as they see fit. So, perfect example. So 3 months is the federal rule, but depending on the state that you live in, you could have a very wide range of months that you're allowed to be enrolled in a short-term medical plan. And then whether or not you're allowed to re-enroll in that plan when you get to the end of those months varies state by state too. So, like I said, perfect example, in Missouri, you can be in a short term medical plan for 36 months. That's 3 years. That's the maximum allowed by the federal rules. But in Kansas, you can only be enrolled in a short term medical plan for 123 months. Kansas is where I live. No idea where they got that number. But Kansas's Department of Insurance tends to make any of the non-ACA compliant plans just a little more difficult. They make it more difficult for the insurance companies. There's not as many of those plans available. So just know the examples that I'm going to show you here in a little bit, or what your friend, sister, cousin, whatever it may be in another state has available to them, very well may not be available to you, and the differences from state to state. So, like I mentioned, the Department of Insurance, it really is kind of the ruling entity in each state that is going to set and then govern all of these rules on the insurance companies. And not only can they set rules around, time frames and stuff like that, but they're really going to, put the rules around things like, our insurance companies even going to be able to offer a certain plan design. They can approve it or not approve for an insurance company to sell a specific plan design in their state. They may say, okay, you can sell that plan design, but you have to modify it. So I think a really good example of that is, if you remember where I said the short-term medical and the indemnity plans all had pre-existing conditions. Well, there are certain states who will not allow an insurance plan to impose pre-existing conditions that would basically result in the insurance company not having to pay for services related to a condition that was already existing when the member enrolled in the plan. So, in some states will say, you can sell that plan here. People can enroll in it, but you have to get rid of your pre-existing conditions clause. Some insurance companies will do that. Some will say, nope, that does not fit the benefit. It does not fit the model of that plan. We won't sell it here. And then that won't be available. In some other states, they're not so forgiving with the insurance companies and they just say, nope, it's not comprehensive major medical. You cannot sell that plan here. So those are just a couple of examples of the different rules that can drive why some plans are available in one state but not the next, or why the same plan with the same plan name by the same company is available in one state and the next state, but they're either priced very differently or feel very different when it comes to what the coverage is. So then we have kind of the complementary coverages. So these are going to be things like a cancer policy, a heart attack and stroke policy, an accident medical expense policy, or sometimes there's just kind of blanket ones called critical illness policies. So what these complementary coverages do is they cover a very specific medical event, condition, or diagnosis and provide extra coverage for that very specific medical event, condition, or diagnosis that the plan covers. A lot of them, especially when we're talking about cancer, heart attack and stroke, and critical illness, the way those benefits are set up is that they have a lump sum benefit amount. So the benefit is simply a lump sum dollar amount that you chose. And I've seen them range anywhere from $2,000 all the way up to $75,000. Now, not every plan offers that range, but that range is out there between the different insurance companies. And so how that works is you pick a dollar amount and your premium obviously is going to get higher with the higher that dollar amount gets. And say you have a cancer policy, if you're diagnosed with skin cancer, everything except skin cancer, unless it's malignant melanoma. But if you're diagnosed with a life-threatening cancer or an invasive cancer, then that's it. It's paying you the dollar amount. So a really common dollar amount for a lot of people is $20,000. So they enroll in this cancer policy at a $20,000 benefit level, and the premiums are very reasonable. That premium, it's going to depend on your age, your zip code, and your gender, just like most other things. But it could be somewhere between $50 and $100, let's say. And so you pay that whatever your premium is monthly. If you are diagnosed with cancer, you submit a claim with proof of diagnosis, and it's paying you. You're getting a $20,000 check. You are not taxed. That is not considered income. It's also not tied to your medical claims. So the insurance company is not going to make you prove your expenses related to cancer. They're not going to try and dictate how you spend that money or when you spend that money. It truly is once you provide proof of diagnosis, or in the case of heart attack or stroke, once you file a claim and provide proof that you experienced the covered medical event, it's going to pay you the benefit within the policy. So where that can become very beneficial to a lot of people depends on your stage in life, but probably first and foremost, people are going to use that money to cover any deductibles, co-insurances, co-pays that they are responsible for after their insurance pays. that can be very expensive when treating a complex condition like that. But so they are gonna use that to pay medical bills. They could use it to pay their mortgage. So probably the second common use of that money is loss of wages. And even if the patient themselves isn't working, maybe it's a spouse or a friend. Maybe they help supplement the income of somebody who's helping get them to and from doctor's appointments, or just helping them as a caregiver who has to miss work. They could pay that person money that way. There's also a lot of experimental treatments in cancer. This is huge right now. There are several, especially when it comes to immunotherapy treatments, that are being very successful, especially with hard to treat cancers. But if you cannot get in a clinical trial, or if your insurance plan does not cover participation in clinical trials, you may not be able to get that drug, that immunotherapy that is at least showing to be very effective for your type of cancer without paying for it out of pocket. Or especially for people who are on Medicare. So this is not the cancer, heart attack, and stroke are plans that I recommend to even people who are enrolling in Medicare or already on Medicare all the time. They usually don't need so high of a benefit amount, because if you have the right Medicare coverage, you should have very low out of pocket costs for medical care. But going back to the experimental treatments, even if, say, you do get the immunotherapy covered, the drugs to help support your immune system or help support kind of the effects that it has on your body, or just medications that you need to take for a certain amount of time after the therapy, they can be extremely expensive and not necessarily covered under your prescription drug plan yet. And like I said, even on Medicare, Part D tends to run a little slow. Part D is the part of Medicare that covers drugs, with adding new drugs to their formulary. So these cancer, heart attack, and stroke plans can come in very beneficial when it comes to, covering costs that may not be covered by your insurance. Also, a lot of people live in rural places where the hospital that you either want to go to or need to go to for care is not close, and you're having to travel. Where I live in Northeast Kansas, if you have something major go on, you're not getting treated in Manhattan. You're not even getting treated in Topeka, which is only an hour away. You're driving 2.5 hours to the University of Kansas Medical Center in Kansas City. That's 5 hours each trip. A lot of times you end up staying overnight. So that, $10, $20, $30,000 policy that pays out if you experience a major medical event can also become very, very helpful when it comes to covering transportation or even medical supplies. When you undergo chemo, there's a rule that's been around since the 90s that women who undergo chemo because of cancer have to have, the insurance company has to cover a wig benefit. Well, it's only $250. I helped my mom shop for a wig when she was undergoing chemo, and it's hard to get a good wig for $250. So if you don't have anything else you would need to spend that money on and experience that, I guess you could at least get a really, really nice wig. But all jokes aside, because it really is not a joking matter, there's just a laundry list of things that, cost more, extra expenses. And so these policies can come in really handy. I really like to couple these policies with some of those other options that either have higher deductibles or maybe only pay set dollar amounts to provide an extra level of protection, um, again, for the what if. But where it really gets interesting is when you strategically are able to kind of package these things together to provide really, really good protection at a much, much lower cost. So this is the exciting part. This is probably what you guys have been waiting for. This is definitely what I have been waiting to show you, is a couple of, these are real life examples of workups that I did for the spouses of other UP retirees who their husband went on Medicare, became Medicare eligible, and they did two different things here. So we'll talk about that. But they were paying a lot for their health care, and they're fairly healthy, not high utilizers of the healthcare system. So I'm going to walk you through what we did for them. I'm sure your eyes are already being drawn to for this particular individual, we saved $5,000 a year just in insurance premiums. So let's talk about kind of how that worked. So she was on the COBRA plan. So when her husband retired, they were both on the railroad worker early retirement plan, which when he wasn't Medicare eligible, they were not paying a lot of money for both of them to be on the plan, and it offered good benefits. It's what they were used to. They were happy with it. They were not prepared for when he went on Medicare, that in order to keep that plan, her cost was going to go up to $1,200 a month. But they didn't know what to do, and they'd been paying this premium for several years. But like most people, they never shopped for medical insurance. They had always had it through an employer, in this case, over 30 years from the railroad. So they definitely just did not even know where to start, and were paying the $1,200 a month. She's healthy, not on any medications, goes to the doctor maybe once or twice a year. And for $1,200 a month, that it's just wasn't for them wise use of that money. So what we did with her, and really this number is quite a bit higher than it would be for a lot of people because she was a smoker. She does smoke cigarettes. So this indemnity plan that we enrolled her in was about $300 more than it would be for a non-tobacco user. But when she was already paying $1,200 a month, it was still a great deal. But we got her in what is called a Health Protector Guard plan. That is one of those indemnity plans that we talked about. So it has a set schedule of benefits. But for instance, if she gets hospitalized, it's going to pay $3,000 per day that she's in the hospital. If she is in the ICU, it's going to pay $6,000 per day. Plus, it has dollar amounts that it pays for, the doctor who visits her in the hospital, a separate dollar amount that it pays if she has surgery, a separate dollar amount for the anesthesiologist if she has surgery in the hospital. So we picked a plan with the higher dollar amounts because there was really no need to couple it with a different plan based on where she was and what her needs were. But just to make sure that she had kind of some added protection, we threw in an accident medical expense plan. So this plan does not pay a flat dollar amount if she has an accident, but what it does pay is some pretty significant dollar amounts if she incurs medical services as the result of an accident. So what that plan looked like was, and an accident is basically going to be an injury that is not intentional. So if it's not a disease of the body or an intentional injury, then most likely it's going to fall under the accident plan. So if she was hospitalized, that plan would pay $1,000 a day, while she still has her indemnity plan that's going to pay $3,000 a day. The accident plan also covered an amount for surgery, like her indemnity plan did. It covers an amount for doctor's visits, just like the indemnity plan does. And when you have these particular set of plans, they don't coordinate benefits, which means the insurance companies aren't going to stop and say, hey, who else is responsible to pay here? Did another insurance company pay? Because if so, we're not going to double pay. We're not going to pay what they already paid. That's called coordination of benefits, which, most plans that you're used to do have. These plans do not coordinate at all. So in that situation, highly likely that you would walk away from those services with getting money back in the mail. She was particularly concerned about the cost that would be incurred if she were to be diagnosed with cancer, or if she were to be diagnosed with experience a heart attack or a stroke. So we went with pretty high benefits on the cancer, heart attack, and stroke plans. And I apologize, I am in Kansas and it is spring and it is thundering so loud right now. So if you're hearing that in the background, that is a wonderful spring evening thunderstorm. I apologize for that. But we went much heavier on the cancer, heart attack, and stroke benefits than what's always necessary. But that's where her comfort level was. And to be honest, there is a lot to be said for comfort. Still, she was saving so much money, it made sense, and it's never going to hurt to have those benefits available. So we did a $25,000 cancer policy, $25,000 heart attack or stroke policy, and both of those policies had what is called a recurrence benefit. And so what that means is, once a certain amount of time has gone by, let's say she's diagnosed with cancer, finishes treatment, after 2 years, if cancer reoccurs, either that same cancer or a different cancer, she's eligible for benefits again after 2 years. So that's great, because a lot of times you can't get one of those policies after you've been diagnosed with cancer. So it's nice to have a plan that is going to start working for you again after a set amount of time. So we included the reoccurrence benefit on the cancer and the heart attack plan. So as you can see with all of that, she's got very, very adequate protection. So she has this very rich indemnity plan that should more than cover her services. She could still have some out-of-pocket costs in some situations, but the indemnity plan compared to the COBRA plan, she was saving $550 a month there alone. Then we add in the accident plan that's going to cover pretty much anything, especially anything that's an injury, especially when coupled with the indemnity plan. Very unlikely to have out-of-pocket cost for an injury. If she did have one of the big what ifs occur, she is, likely it would be, cancer or heart attack. Those are the two most common major medical events. Either one of those or a stroke, and she would be receiving a $25,000 check that could help offset any cost if the indemnity plan didn't cover it. Now, if you stop and think about the COBRA plan, if you were to be diagnosed with cancer or have a heart attack or a stroke, you're likely going to hit that $5,000 out-of-pocket maximum. So if you look at what she's saving per month, over 400, and over the course of the year, over 5,000, and then you also add in the fact that with this indemnity plan, she doesn't have a deductible or coinsurance or an out of pocket to meet before insurance starts paying the maximum amount of benefits that they're going to pay. She has insurance plans that are paying from the first claim without her coming out of pocket first. She very possibly could also be saving $5,000 in medical expenses. So that $5,000 number, right, in annual savings and premiums could very possibly be $10,000 if she does have a major medical event because she's avoiding medical bills, those automatic medical bills that are going to come with other plans. So I know for a lot of people that can sound crazy, that can almost sound too good to be true. But I've had the pleasure of helping several spouses enroll in plans just like this, in situations just like this, where they were able to save a very, very significant amount of money. Um, Another spouse who I helped with a plan that they purchased as individuals, but still they were paying $852 a month. And we did a similar, it was a little bit different setup for her. We did a short term medical and an indemnity plan that her total was only $412 a month. And last year, when she was paying $852 a month, she stepping out of the RV at the lake that they fish at every spring, she broke her ankle or a bone in her foot, one of the two. But that misstep, that broken bone, made her meet her $5,000 out of pocket maximum. So she did hit her $5,000 deductible out of pocket maximum on her plan. So with her, if she just had the same misstep happen, like that, did something that made her incur $5,000 in cost, the plans that we put her on, she absolutely would not have those expenses. It's hard to, in a hypothetical situation, but looking at what she had last year, she absolutely would have not incurred those costs, plus saved about $430 a month. So we could absolutely say she's saving about $11,000 in insurance by taking a different approach. I want to go back and show you one more example, where I think this is something else that is important to understand and kind of important to consider. So one of my goals always in working with people is making sure that your healthcare dollar is being stretched absolutely as far as it can. Now, we don't want to stretch it to the point where it gets thin or gets holes in it, but we do want the money that you are spending on healthcare, especially healthcare premiums, to give you the most protection possible. And so that's where it's really important to look at your whole benefit package. And I think this next example does a really good job of kind of putting things into perspective. So if we look at this over here, the retiree was already on Medicare. We were able to make a plan change for him that saved him $126 a month. The spouse, we moved from Cobra to the plans that you saw in this last example here. So she moved from paying $1,200 a month in Cobra to an indemnity, accident, cancer, heart attack, and stroke plan. And that saved her $412 a month. All in all, this couple is saving $538 a month, which is almost $7,000 a year. And this is just in premiums. Imagine that. Almost $550 a month that you're spending less on premiums, $7,000 a year that you're not spending on premiums. There's a lot more fun things that you can do with that money. If you go to my Facebook business page, the Complete Health Benefit Solutions, and I pinned a post that one of the retirees that I recently worked with put on my wall, who said exactly, I think he said something like he's as happy as a pig in dirt about how much money he's saving and that he's spending it on fishing. Well, luckily I got to know them well enough to know that his wife really enjoys going on the fishing trips too. So if you're able to save this money, hopefully the couple can agree on the ways to best spend that money. But I love that story. This, I absolutely think, is dollar amounts that can change people's lives. Maybe not completely change your life. You're not going to be buying a mansion, saving $7,000 a year on insurance premiums, but that is absolutely extra trips to see the grandkids or bringing the grandkids out to see you, or fishing trips like in Mike's situation. I know I talked to a couple in Iowa who had an insane calendar of golf trips planned all summer. Even if it's just something extra special or in addition that you get to do to enjoy your retirement, that's valuable to me. So in this one, we had a conversation going back to stretching your healthcare dollar. We don't want to throw away healthcare dollars and spend more money than you have to on healthcare and make it be a complete waste. Rather have you enjoy that money, but also want to make sure that you do have the adequate protections in mind. So just to show you over here, some of the other benefits that we talked about for them. They've been going without dental and vision. So we took a look at dental and vision. Also took a look at final expense. So they both had some term life insurance policies that the value goes down over time to the point where, if they passed away in their early 80s, that short or that term life insurance wouldn't be worth much of anything. So while they were younger and the premiums were still more affordable, they wanted to get some final expense insurance in place just to make sure that when they did pass, that their funeral expenses would be covered. We also looked at some recovery care, which that's going to pay for people who do not have long-term care insurance in place. That's going to cover like your stay in or you're living in a long-term care facility, whether that's assisted living or a nursing home. Those policies get much more expensive to buy the older that you get. If you don't have one in place and you're already in your mid 60s, recovery care is a good alternative. And that's going to cover whatever you pick as far as days and dollar amounts of skilled nursing facility care and home care costs. It makes a big difference. So we looked at all of these for them. If they went with just the regular dental policy without doing the buy-up, if they went with just basic vision policy that does cover, materials every other year, and $10,000 each in a final expense policy, and a pretty comprehensive recovery care plan that paid, I think, $600 a week for home care for up to 13 weeks. That's over 3 months. As well as, I think, 6 months in skilled nursing facility care. For just $81 a month. If they added all that, which not everybody adds everything, but they add what they need. If they added all of that, they would still walk away saving $262 a month compared to what they paid last month for a fraction of that coverage. No dental, no vision, no final expense. Definitely no recovery care. Plus, if she experienced something major, likely around $5,000 in out-of-pocket costs, um, having none of that coverage plus paying 262 more than what they will pay in June with all of these additional coverages, plus very likely reduced medical expense costs. Really something that we would have to look at on an individual level. Plus, there has to be a very open and honest conversation about what your medical needs are, what your medical history is, and do something that fits for you. Do something that is right. It really is an individual based decision. And we really have to look at your specifics and the specifics that are available in your area. But what I can tell you, especially if you are paying $1,200 for the Cobra plan, that there is very almost, I'm not going to say guaranteed, because there are some states out there that make it really hard for flexible options to be available. So it is highly likely, is where I will leave it, that you could be looking at saving a significant amount of money on premiums, and then maybe even medical bills if something did come up, plus putting some better coverage in place that's going to cover a wider array of medical needs, medical services. But I just really want to make sure that I'm getting you guys the information in a way that is helpful to you. Fill out the survey, just respond and shoot me a couple lines, over email. I'm just really looking for feedback on how I can best get you this information, because I know it's a lot of information to take in. I know that I probably make my videos a tad bit too long, or just too long, period. I just really want to make sure that I'm getting you guys the information in a way that is helpful to you, and making sure that I make it available. So I'm curious to your feedback on these videos, or if you have any other ideas. Again, thank you so much for not only taking time to listen to the information I have to share, but also the length of time that I know you committed to it. So please reach out if any of this you think is something you want to look at, or even if you just have questions at all. Thank you so much.